Thank you very much, Ms. Hunter, and also to Mr. Foster Mohale. Let me also welcome the presence here of our WHO country head, Dr. Fabian Denzako, and also Dr. Jackie Meyer from the NICD and all other colleagues who are here present. As Foster has already indicated, we just needed to update the media and the public in terms of developments with the Mpox. Now, a global outbreak of Mpox was announced by the WHO in 2022. You may remember that just at the end of the COVID pandemic, then there was the monkeypox, now called Mpox outbreak in various parts of the world. Mpox is a notifiable medical condition which the healthcare workers are required to report all the suspected and especially the confirmed cases. Notifiable medical conditions refer to diseases that are of public health importance because they pose significant public health risks that can result in disease outbreaks or disease epidemics with high case fatality rates, both nationally and also internationally. The previous outbreak of Mpox in South Africa was in the same year that the WHO announced the international outbreak in 2022. During that period, we had 5 cases confirmed in the Western Cape, in KwaZulu-Natal, in Limpopo and Gauteng. But in the course of 2023, we did not report any confirmed cases of this disease of Mpox. According to the WHO multi-country outbreaks of Mpox, which was published in May this year, cumulatively from January 2022 through to end of April this year, a total of just over 97,000 laboratory confirmed cases of Mpox, that is worldwide, and in this 186 were fatalities from 117 countries in all the 6 regions of the WHO. A total of 528 new cases were confirmed in the course of April this year. But this, we must indicate that we're actually representing a decline. Is the microphone not on? This was actually indicating a decline in cases if we're comparing with previous months. Just as I said, this was in April. If you look at previous months, it was showing that there was a decline. The most affected WHO regions in order of the number of laboratory confirmed cases were the Americas, the region of the Americas, the Africa region, the European region, the Southeast Asia region, and the Western Pacific region. In the African region, the DRC reported the most, with just over 99% of the confirmed cases of the continent being in the DRC in the reporting month. Just as before we came here, we were just discussing with WHO and the NICD experts, and they were indicating to me that actually in the DRC, Mpox is considered to be endemic. And also, as we discuss further, that the variant in the DRC is different from the variant which is multi-country transmitted. The disease is caused by a monkeypox virus, which is an orthopox virus that transmits from person to person through close contact and from unknown animal reservoirs in East, Central and West Africa, including DRC as one of those countries. Multi-country Mpox outbreak is characterized by sustained human-to-human transmission via direct skin to skin, and also sexual contact. People living with HIV are disproportionately affected due to immune suppression. South Africa is amongst the countries currently experiencing the current outbreak. This infection, which, as I've already said, spreads from one person to another, although also being transmitted from animals. In the current outbreak, we have recorded 5 laboratory confirmed cases, and regrettably, one of those have passed away. 2 of these cases were confirmed in Gauteng and 3 in KwaZulu-Natal. The death that occurred is amongst the 2 cases in Gauteng. This patient passed away late on Monday this week, Monday the 10th of June, in Tembisa Hospital. All cases and all the patients are males aged between 30 and 39 years without any travel history to other countries which are experiencing outbreaks. So this then says to us that we do have local transmission. It's not imported cases. All 5 cases were classified as severe cases as per WHO definition, and they were requiring hospitalization. The cases have comorbidities and have been identified also as part of what we regard as key populations, which include men who have sex with men. Thus, the department is reaching out to organizations who are working within the South African National AIDS Council, organizations focusing on the HIV programs, and also working with key populations, in addition to other stakeholders, to implement targeted communication and to intensify awareness about the outbreak and the fact that we can confirm that there is local transmission. One of the patients has been discharged. One has also been discharged home, but for further isolation, being followed up. The 2 other patients are still admitted in hospital. As we said, there were 5 cases. 1 has passed away, and the other 2 are still in hospital. 1 is being followed up at home, and the other one is discharged completely. Sequencing analysis of 3 of the cases revealed the category which is called Mpox clade 2B. And that this is important, as I indicated, the experts were indicating to me that the variant which is dominant in the DRC is not the clade 2B. They will explain how it differs. It's clade 1, so that it's a different one. But the clade 2B is the one which is dominant in the multi-country Mpox outbreak, which began in 2022. So the ones in our country are consistent with the multi-country outbreaks in various parts of the world, and different from the strain or the variant in the DRC. So, as I've indicated, we've had 5 cases thus far. The first one on the 8th of May in Sidibeng district in Gauteng, a 35-year-old male. I've said all of them are males. The second case was on the 21st of May in eThekwini, 39 years old male. 31st of May, the third case, also in eThekwini, 30 years old. And on the 3rd of June in eThekwini, also a 33-year-old male. And lastly, it's on the 7th of June, the male patient who was admitted to Tembisa Hospital, who unfortunately is the one who demised. The further history of the patient who demised indicates that he's originally also from KZN, but he's not been in KZN for some time. The medical history indicates that he left KZN in December, although he's got family there, but he left KZN in December and he had not been home since that time. So it doesn't look like there's a link with the KZN cases over about 5 months. Now, all National Health Laboratory Service laboratories have been sensitized to the ongoing outbreak and are referring samples for testing with the NICD. The private sector laboratories are also testing for Mpox, while NICD serves as the reference laboratory. Since the beginning of 2024, the NICD has received 12 Mpox test requests, with 3 testing positive. The other 2 cases were diagnosed by private laboratories. Guidelines have been updated and shared widely across networks of health workers using various platforms. The National Institute of Communicable Disease, the NICD, continues with epidemiological and surveillance activities to identify cases for investigation, to estimate the magnitude of the disease through systematic data collection and analysis. A total of 38 contacts were identified in KwaZulu-Natal by the outbreak response teams. The contacts include household contacts, about 16 of those, hospital contacts, partners, sexual partners, friends. One of the cases from the KZN patients did confirm that he had sexual contact with multiple partners, and that those partners include both males and females. So as much as this is dominantly, as you can see from the patients, that it's mainly men and also associated with men who have sex with men, but we're also conscious of the fact that women are also affected. And as you can also get from the case history of one of the patients. Regarding the case notified on the 8th of May in Gauteng, 7 contacts have been followed for 21 days, and none of them showed any signs of symptoms of Mpox. Regarding the case notified on 7 June, that's the last one who demised, the list of identified contacts was being developed, and they will be monitored for 21 days. So I must indicate, and as we communicate with the public, it's also to encourage that people who, for one reason or another, may know that as much as we cannot disclose actual identities of the patients in terms of confidentiality, but we encourage people who may know that in one way or another they have an association with somebody with the disease, to, if they show any symptoms of skin lesions, rashes, to approach the nearest health facility so that they can be tested. Provinces have been notifying all the cases that meet the case definition of a suspected Mpox case in the notifiable medical condition system. Meanwhile, the outbreak response team, comprising of experts from the health department, from national and provinces, and the NICD, and also WHO and other stakeholders in the health sector, have embarked on contact tracing and case finding in affected provinces. We can just indicate that in our discussion, it did actually come out that it is not easy to do a full tracing. Sometimes it's difficult to exhaust all the contacts, unlike in terms of other ailments like TB, like when we had COVID as well, because of the stigma which is still associated with the fact that it is a disease which is associated with a certain sexual orientation. It makes it a little bit difficult to always get to the bottom and trace all the contacts. In terms of treatment interventions, at the current moment in South Africa, we don't have a registered treatment for Mpox. However, the World Health Organization recommends the use of an antiviral treatment called tecovirimet. This is an antiviral agent which has shown to be useful in the treatment of Mpox, and it's mainly used when patients are severe, and also, as we have indicated, that it gets more severe with patients who are immune compromised, and also in all our 5 cases, the clinical indication is that all of them were immune compromised. So, and especially when the CD4 count is less than 350, then this antiviral agent then is used. Although it's not registered with our South African Health Product Regulatory Authority, SAPRA, the Department of Health has obtained from SAPRA an emergency use approval, which is called a Section 21 approval for compassionate use for patients with severe disease. So that has been obtained. So 3 of the cases have actually been treated with this tecovirimat as advocated by and guided by the NICD. It was obtained through the Section 1 approval, emergency compassionate approval by SAPRA, and also we got that it donated through WHO. So SAPRA has currently approved for our department to can actually obtain bigger doses of this antiviral in case there are more cases, and the WHO will assist us in terms of getting access to the treatment, so that if there is further outbreaks with severity, then this can be utilized. We are also looking at obtaining vaccines, Mpox vaccine. Options are being considered as to from our department working with SAPRA and WHO. We are also accessing the vaccines, small doses of the vaccine, and we then still working on who will be the priority target in terms of the vaccination. So we're trying to source that from WHO member countries who have stockpiles that exceed their needs, but we're also approaching Gavi, the global organization, which also distributes vaccines to access these vaccines. So these vaccines, once obtained, will be distributed to all provinces so that those at high risk can then be vaccinated. So our National Advisory Group for Immunization technical group has been established, which will then guide how the vaccine will be used. So this will be used for high-risk groups, including but not limited to sex workers, those who have identified as high risk, also, as I've said, men who have sex with men, health workers, and also laboratory workers will be prioritized in terms of vaccination. From a communication point of view, our department has been working with partner organizations to intensify targeted and public awareness using various channels of communication to make sure that the public is sensitized about the risk of this Mpox, so that people can know when they are at risk and take action in terms of approaching health facilities. As part of additional efforts to increase opportunity for engagement, a clinical management webinar has been convened and was attended by 500 healthcare workers and public health professionals from across the country. Now, the most important intervention at present remains communication and community engagement, which is being implemented, including addressing the high-risk populations, as I've indicated, sex workers, also men who have sex with men. But we have to deal with this with a lot of sensitivity so that we don't exacerbate the stigma, which can also cause problems. We are also reaching out to organizations who are, as I've said, within civil society organizations in SANAC, and also those organizations which are also focusing on the key risk population. In as far as travel, there is no recommended travel alert. As we have said, that this is an infection which spreads through very close contacts. It's not like influenza and the aerosol, those which spread through the air. It spread through very close contact. So there is definitely no recommendation for any travel restrictions. We can indeed prevent further spread if anybody who has suspected symptoms must present themselves. And again, just to emphasize the fact that its presentation is in the form of skin lesions, eruptions on the skin, and very painful lesions on the skin. Those who have had chickenpox will know that chickenpox also presents as a skin eruption. So all this pox, chickenpox, Mpox, so they develop with. So I think one can safely say that, especially for adults, anybody who develops those kind of eruptions on the skin, painful, even if you may think it might be chickenpox. So even for young people, the advice would be that they should seek medical attention so that it could be tested. As we have seen that, especially with those who are immune compromised, we have already had one fatality. And this patient was quite sick, and we were informed from the hospital that even though the antiviral agent which I've mentioned was available, because of the severity of the source, the patient could not even swallow the treatment, and unfortunately demised within a few days. So our endeavor is really to prevent any further deaths and to call upon our population that first of all, if you have had any contacts, make sure that you can be monitored, and if in the event that you develop any kind of skin lesions, go to the nearest health facility so that they can be tested and make sure that it is definitely not this Mpox. So we'll end it there, ladies and gentlemen. Thank you very much.